How can we straighten our crooked teeth with little money and no pain at all? We will also learn everything about sleep apnea and the risks associated with it. We will also talk about psoriasis. You should know that psoriasis is not contagious, so don't be afraid of it and don't be afraid of people who have this condition. So let's start with our teeth, because I have to tell you, as we've said before, smile is one of the most important features of the face. That is the eyes and the smile. Unfortunately, many people nowadays have crooked teeth. They struggle with crooked teeth, but they don't fix them because they don't want to spend a lot of money. They are afraid it will hurt. They are afraid that some problems might develop in their mouth, or even that people will make fun of them for wearing braces. But now things have changed. Orthodontic technology has advanced. And with us today is Mr. Evangelos Viazis. Welcome!
Welcome, Katerina. I am very glad to be here with you and to talk about Fastbraces, an orthodontic technology that gives everyone the opportunity to have straight teeth very quickly.
Can this dream really come true? Can we, hold on a second, have straight teeth, low cost, no pain, no problems, and no tooth extractions? Is that possible?
Yes. Everything you just mentioned is what the Fastbraces technology offers.
Yes.
Its main feature is that in 80% of cases, the treatment time, the time for complete orthodontic treatment, ranges from 3 months up to 1 year, while a large percentage of cases can even be finished in just 120 days.
Hold on a moment. What you're telling me now is extremely important, because I know people who had braces and struggled for even 2 years, and now you're telling me from 3 months up to a year. 3 months to a year?
Yes. That's right. This is due to a very unique and innovative bracket. When we say the word bracket, we mean the brace, and this brace has the property, it has certain specific properties that reduce the treatment time because it causes a different type of tooth movement compared to older orthodontic systems.
Could you please explain, Mr. Viazis, what is the distinction or difference between the old braces and the braces with Fastbraces technology?
So, the shape of this particular bracket is triangular. This triangular shape, together with a specific orthodontic square wire, has the property of moving the entire tooth to the correct position from the very beginning of the treatment. In other words, it moves and activates the movement of the tooth root right from the start of the treatment. Older orthodontic systems used to move the crown of the tooth, that is, the visible part of the tooth first, and only in a second or third stage would they manage to move the root of the tooth using various orthodontic systems. This particular system, Fastbraces, moves the entire tooth into the correct position from the very beginning of the treatment using a single orthodontic wire. This movement that is caused in the teeth well, thousands of doctors who use this system around the world claim, as do I, that it is similar to the natural eruption of our teeth when we are children, that is, when we are around 12 years old and we are losing our last baby teeth.
Yes.
In order for the permanent teeth to come in, the time required for the permanent teeth to take their place is about 3 to 5 months. Therefore, the movement caused by this particular system is similar to the natural eruption of teeth, which explains the very short treatment time. We start with the forefront teeth.
But it's very encouraging, to see. I want us to look at some cases, and explain exactly what happens, how things were before and after. So in the last 25 years, the Fastbraces technology has been tested with great success in more than 50 countries.
Yes.
And is he an inventor?
Yes. The inventor of the Fastbraces system is my brother, Evangelos Viazis. My brother was a professor at various universities around the world. He was, in fact, an assistant professor at the University of Minneapolis in the United States, at Baylor in Texas, and an associate professor at the University of Southern California.
We can see your brother here as well.
Yes.
So he is the noted inventor of the innovative Fastbraces technology, the founder, then...
My brother accomplished all of this at a very young age. Just imagine, he entered dental school at only 17 years old because he managed, thanks to a transfer his father got to America, to complete 3 years of junior high in just 2 years. Anyway, he has done so many things in his life, and as soon as he ended his academic career, he devoted himself to expanding the system.
So, let's take a look at the case. What do we see here?
So, pay attention. All the cases we're about to see now are meant to make one thing immediately clear to everyone. With this system, permanent teeth are almost never, practically never, extracted. In other words, apart from being very fast, permanent teeth are almost never extracted.
What are we seeing here?
This is a patient from Argos. Everywhere she went, they told her she needed to have 4 teeth removed. 4 teeth, 4 first premolars, but with this particular system, we didn't have to extract any permanent teeth. On one side is the before, and on the other is the after. And it's the same on the upper teeth.
So without any extractions at all,
No extraction.
we put on the braces. And now that we've shown this, someone is asking us, my friend, says they told her she would need to have teeth extracted if she gets braces. Is that true? Is that the case? I mean, was it like that in the past?
Of course, because in the past they used to each doctor would measure the available space. With this particular system, there's no need to measure any space at all, no matter where the teeth are. Even if there is zero space, absolutely no space, we can create alveolar bone from scratch. So the patient doesn't need to have any space at all. So we have another characteristic case here. Let's take a look at it here.
Yes, here there is zero space, as you can see at the canine. Yes.
With any other dental system, they most likely would have told her to extract a total of 4 teeth. Here, there is no need to extract any teeth at all.
Another friend of the show, Mrs. Viazis, asks whether her teeth will be cleaned properly and if there will be no risk of cavities if she gets braces.
Yes, now pay attention. With any orthodontic system at all, if someone cleans their mouth very well, there is no problem with cavities. Now, let's consider the case where someone does not clean their mouth properly and does not maintain good oral hygiene. With this particular system, cleaning is much easier because the shape of the bracket closely resembles the anatomy of the tooth, making it easier for the patient to clean their teeth. Now, let's also consider the case where someone is completely uncooperative and doesn't listen at all. This happens it's a very common phenomenon for a patient not to listen at all, not to brush at all. Well, with this particular system, even if the patient is that undisciplined, nothing has time to develop because the treatment time is very short. So it's over very quickly.
And another case, a characteristic case. What are we seeing here now?
Yes, the same thing. There are zero spaces in the canine area, and the mouth is corrected without the patient needing to have any teeth extracted.
From what age can someone get braces?
So listen to me.
I want you to tell me from what age someone can get fast braces, and also for their child. If their child has a problem, when can they be put on?
Listen now, so we can clarify this. For the first time, the patient can come whenever they want. The best thing is for us to see them around the age of 7. We almost never intervene at that age. But we will check if the permanent teeth are erupting in the mouth. We don't care where they will rise or how they will rise. What matters to us is that they erupt. From then on, we will monitor them every year until they have all their permanent teeth in their mouth, which is around the age of 12 to 13. That's when we intervene, and in this way, the patient will only go through a short period of inconvenience and will end up with a perfect result. Therefore, there is no need, we guarantee the patient that there is absolutely no chance we will extract permanent teeth. So there is no need to start treatment at a very young age.
All right. So what exactly do we have here?
Pay attention. This is a published article about one of my own clinical cases, which is the most well-known clinical case worldwide treated with this particular orthodontic system. So when this patient came to the clinic, in order to demonstrate to other doctors around the world where various seminars are held on this technology and to show my brother, who is the inventor, just how effective the system is, we placed only 4 brackets on the forefront teeth for quite some time. That is, for the first 3 or 4 months, we worked only with those 4 brackets, and you can see how effective this particular system is. With just 4 brackets, the forefront teeth were straightened without us adding anything else at the beginning. Afterwards, we placed brackets on the remaining teeth. The treatment lasted about a year because it took about a year, and if you look at the later photos, you'll see, let's move a bit further ahead.
Yes. Can I ask something else?
Here you can see again, there are 0 spaces before and after, and the teeth were preserved without extracting any permanent tooth.
The result is perfect. An excellent outcome. It's really very important what you're telling me, that without extractions and without pain. I want you to tell me about this. I mean, I knew a girl who got braces, and after 2 years, I think she wore them for a year and a half. She was in constant pain. She had a really big problem. She was desperate to get the braces off. What's going on here?
As I told you, yes, of course. As I mentioned earlier, this particular system moves the teeth in a way that mimics their natural eruption. So there shouldn't be any pain symptoms and the patient shouldn't be suffering. The following phenomenon occurs when you first put on the braces. A very large percentage of patients call and complain. In quotation marks, he complains that he doesn't understand anything. In other words, they think the system isn't working because they don't feel anything.
So they're expecting that it's going to hurt.
Yes, they call and say, didn't you put on the 4 braces? I don't feel anything. Is it working? Or should I come in so you can do something to make it work? This happens in 50% of cases. Now, regarding the issue of pain, In 1998, a university study was conducted at the University of Kuopio in Finland, which showed that with this system, although the initial sensation is the same as with traditional braces, any sensitivity or pain quickly subsides, and then the teeth move without the patient feeling anything significant. In other words, the body gets used to it very quickly, which is something we expected to happen in a university study, since the movement is based on a natural function of the mouth, which is the normal eruption of the teeth.
All right, may I say something now, Mr. Viazis? We've received phone calls, questions from friends of the show. They're asking a lot of things. So, we're talking about the new orthodontic technology, Fastbraces. We don't have much time today to discuss everything, but I want us to answer all the questions from the friends of the show. That's why I want you to promise me that you'll come back next time, because I want us to answer more questions from the friends of the show. So here we have www.fastbracesgreece.gr, Mr. Viazis' website, where you can find any information you need. We won your question. Will you come back for me?
Yes, of course, Katerina. I will come. I really enjoy the atmosphere here. And we have
so much more to talk about. So, low cost, no extractions, no pain, new orthodontic technology. Finally, you will straighten your teeth. You will get rid of crooked teeth. Thank you very much, Mr. Viazis, and I hope to have you with me again very soon.
Thank you, Katerina. Everything was perfect. We'll talk again soon.
Thank you very much.